diagnosis of Omicron specifically has certain relevance and value in the current situation. First and foremost would be when clusters appear in areas for the first time. Right now, the infection is restricted to large metros. Very soon, it will be moving to. This is what we have seen in India. I'm sure Dr. Rajesh will agree with me. It started in Mumbai or Bangalore or Delhi, and then it kind of moves out peripherally after a couple of weeks. So in that context, it would be important to know if the new clusters in areas that have not reported them earlier, is it Omicron or not? Number one. Number two, for tracing and tracking, especially in newer areas, a test is at least required in a small number so that it can help in control measures. Number three, the biggest value I see is for individuals. Whatever said and done, there is a fear in people whether they are going to have complications or not.
Right.
If somebody is detected as Omicron positive, it gives a huge sense of relief. That's what I believe is one of the values. And lastly, from the clinical point of view, I would say that there is a small proportion of Delta still doing the rounds, and it's relevant to distinguish Omicron from Delta. And also, there is this huge, expensive monoclonal antibody cocktail, which is being used by many clinicians. We know that Omicron has a large number of mutations in its spike protein, and these cocktails do not work effectively. So you can unnecessarily avoid a treatment that is not relevant. So that is the fourth place I see. So there are four situations I see where Omicron. And secondly, and lastly, most important, there's a huge demand for genomic sequencing. Whether we like it or not, people are asking, and I see Dr. Rajesh nodding his head. Everybody wants a sequencing to be done, and it's such an, it's not, sequencing is not a routine diagnostic test. It's hugely resource intensive. It's time consuming. And from whatever results we got from the evaluation by ICMR, the results of the Omicron had shown 100% concordance with genomic sequencing. I'm not saying that will continue like that, but that itself is it was very, very encouraging for us to see that result. So this is a simple PCR, which is being used as a routine diagnostic tool across the country. There is no extra infrastructure or technical expertise required for it. It also detects all other variants. It's not that this somewhere some people are misunderstood. It can only pick up Omicron. No. The ICMR evaluation very clearly showed that it is 100% sensitive even for other variants.